What's Dr. Cruz been up to lately? Find out on this next episode of Digest This.
Welcome to Digest This, the show that helps you revolutionize your digestive health. Here are your hosts, Dr. Liz Cruz and Tina Nunziato.
Hello, and welcome to Digest This. I'm Dr. Liz Cruz, and I've got Tina Nunziato sitting right here by my side. Thank you so much. We know that everyone is so busy these days, and it means so much to us that you take the time to hang out with us. So here we are. You know what I was noticing?
What?
We're both wearing glasses today.
Oh my goodness.
Oh my goodness.
Wow.
Yes. So anyways.
Why are you, I know why I'm wearing my glasses. Why are you wearing your glasses?
I decided to give my eyes a little break from the contacts.
Oh, very good.
Yeah, just
Excellent.
let them get a little more oxygen.
I see.
Oxygen, that's right.
Very good.
So, what have I been up to? I don't know. I don't know. What have I been up to? I thought it would be fun just to talk a little bit about a couple things that I've been doing lately, and on my journey, my health journey, and I know not this year, was it the year before that we started a series on different things I was doing for wellness?
Yeah, it's been a while since we did
Yeah, I think it was like in 2022 when we did a series on that. And so we haven't really talked, I haven't really said much lately, but so through the years, I've had like this lower back pain, more so like on the left side, and I don't have the greatest posture, and then I'm standing all day long doing procedures. And so through the years, I've gone to the chiropractor, not regularly like I probably should be doing. I do believe in chiropractors. I mean, my mom always went. She had her chiropractor and was faithful with that, and it always helped her. And I feel that it has helped me when I stick to it and when I'm consistent. I tend to start doing it, I start feeling better, and then I kind of, drop off and stop doing it, as opposed to continuing just to go like even once a month or every couple months. And so the adjustments that the chiropractor has done on me through the years has actually helped a lot, as well as techniques for how I should be standing. And but lately I hadn't been in over a year or two, probably since like COVID or before COVID. And the pain really intensified, and so I thought it was time to go back, and so I started going back, and there were a couple therapies, in addition to him adjusting me, there are a couple therapies, services that he recommended that I do, and he has actually several different services there in his office that I really like, and Tina has, I referred Tina and our son, and they've gone to him also through the years, right? It's been years.
Yeah.
So, but there's a couple things that he started doing on me. And so just literally in the last 3 weeks, I started to be more serious about going regularly to him. And the two services that he recommended, and I'm going to be doing a little cheating by doing a little reading here, because, this is stuff that I don't know a ton about, but I think it's fascinating, and I think it'd be really great for us to share this message with you. Okay, so the first one, service that he offers in his office is called PEMF therapy, and that stands for pulsed electromagnetic field. Did you ever have this done?
Yes.
Yeah.
After I had the car accident.
Oh, right. That's right. Pulsed electromagnetic field. Okay. So basically what's happening with this therapy is there's bursts of low-level magnetic frequencies that are being sent directly into the body. Okay.
It doesn't feel great.
No, it doesn't. No, it doesn't.
It feels like you have an electric bolts, like when you get shocked,
Yes.
when you stick your finger in an electric socket, it feels like that.
I don't know, honey, because I don't really stick my
Repeatedly.
finger in electric sockets.
No, but like, like I deal with a lot of changing of bulbs.
Right,
and,
right. Yeah, yeah.
you know,
It's that like electrical.
that shock that you get if you forget to turn off the the light switch before you change out something.
Yes.
Whatever. Right?
Yes.
It's
No.
that. Only
She's
repeatedly.
Yeah, she's right. It does not
Yeah.
feel the greatest.
Yeah.
And they'll ask you, okay, here it goes,
Yeah,
and they'll dial it
What's
up.
the intensity that you want?
Yeah, and you're trying to like, oh, I can take it.
Yeah.
And then when they step away for those 15 minutes, you're like lowering the intensity. So basically, these low frequencies, magnetic frequencies, they go through the skin and they penetrate in to the muscles and and the tendons and even the organs. Okay, and it's basically a non-invasive way to treat injuries, chronic pain, even long-term issues like depression and diabetes.
The idea is it's meant to wake up the area.
Exactly.
Right?
Stimulate it.
It's meant to wake it up and stimulate it so that so that stuff rushes to it to heal.
Exactly.
And try to repair.
Exactly. Try to repair.
Yeah.
I mean, because he told me, look, you've had this discomfort. He told me it's at the sacroiliac joint, probably just with your movements and your posture and just, everyday life, it gets it becomes misaligned. That's right, out of whack. Yeah. And so over time, probably have developed some inflammation and I probably have some scar tissue there. So these two treatments that we're talking, this one and the other one we're going to talk about, help with bringing in, with healing those areas, okay? And it penetrates at the cellular level and basically just starts to stimulate the cells so that they do their own natural healing. And so I thought this article that I found, really nicely summarized the benefits, okay? So there's a lot of benefits to the PEMF. In fact, they've even used PEMF for astronauts that are coming back from missions, who've lost bone, just to try to stimulate their body and get them back to where they're at on Earth when they have gravity. Okay. Yep. All right. So number 1, better circulation. Pain reduction. Number 2, improved muscle relaxation and performance, decreased inflammation and swelling, improved oxygenation in the tissue area. And then because of that, you have enhanced cellular repair and recovery, better sleep, and improved immune system. All right. And so, just a lot of great benefits. And again, like Tina said, I mean, it just helps as far as stimulating those cells, stimulating the nerves in that area to help promote healing. Okay. There's even some evidence that the PEMF therapy can even help with anti-aging because it can stimulate the production of human growth hormone and melatonin, which are two hormones that are known to have anti-aging properties.
And that decline as we age.
Exactly. So, it just works to stimulate the autonomic nervous system, parts of the brain and the nervous system that are controlling our body's healing abilities. So just when I've been going in the last 3 weeks, he does an adjustment, he does this, or they put me on the machine.
He puts it on, there's a pad.
Yes.
So is the pad just then focused on the back, your lower back?
Absolutely.
Because you don't put it on your whole body.
Right,
it's just
right.
Wherever the pain is or wherever you're having the issue, that's where they put it.
Exactly. So. Yeah, they just put it right there.
And imagine that shot going through around your whole body.
I know.
For 15 minutes, but yeah.
Yeah. So pretty cool. So just wanted to mention that. You could look more into it again. It's called PEMF, and it stands for Pulse Electromagnetic Field Therapy. Okay, the other therapy that I think is a new one for their office, because the last time I was there, they didn't have this service. Of course, I haven't been there for a few years. Is called Shockwave therapy.
Yeah, I haven't heard of that.
Well, some of you may have heard of it because
there's so many things out there.
Shockwave therapy is actually a form, it is used in breaking up kidney stones. they call it lithotripsy. And basically what they're doing is using sound, the sound waves, to try to break them up.
They use tools like that to even test the liver function, the functions of the liver, right? Like whether the liver's fatty, how fatty it is.
Exactly. As opposed to, exactly.
As opposed to doing a liver biopsy.
Exactly.
They're doing it.
Right. So shockwave therapy. So I went in, he's like, oh, by the way, we've got this service that I want you to try. Because basically the way they explained it to me is, it's an acoustic sound wave that's penetrating into the tight or the chronically injured area, right? So in my case, on the left side where my sacroiliac joint is, he thinks there's probably already like some scar tissue probably that's formed there just from years of having inflammation there. And so what this goes in there, and it just basically is just sending these shock waves again to help promote healing and to try to break up. Well, when the machine is on it, oh yeah.
Is it loud?
Yes.
Yeah.
Yes, it is loud. And it's like a pulsating, it's actually pretty amazing what they're doing. But yes, I hear it. It's actually pretty loud.
Does it hurt? Like the PEMF kind of hurts a little bit?
So it hurts a little bit, and they can actually on that one also dial it up. And he said that as we go on with the treatment. So again, the treatments are meant to like really, get in there, try to do it intensely for a few weeks with hopes that then we can back off to maybe doing it like, once a month or once every 4 to 6 weeks, maintaining.
Yeah. How long does that treatment last?
It's about...
The PEMF is usually like a 15-minute session.
This is like
so
10, 15 minutes.
Okay. So it's literally just like the thing is beating on you in one area for 15 minutes?
Yep. Exactly.
Ay, Chihuahua.
Exactly.
So you do the PEMF first or shockwave?
It doesn't matter. Oh. Like last week I went in and I just did the sound wave, the shock wave with an adjustment. The 2 weeks before I did both. Then after that I was like, okay, I'm just gonna do one of these.
I was gonna say, your poor little back.
Yeah, just one of these at a time with the adjustment.
Oh.
Yeah, we'll just go with that. But I just wanted to read some of this here, and this is actually off of our chiropractor's website. And I actually looked up a few other things, and it basically said the same thing. So. So again, the shock wave creates an acoustic sound wave, not ultrasound, that penetrates into that chronically injured area. And it just, it allows for faster healing, restoration of the connective tissue. There's no electrical shock with the device. It's literally just an acoustic wave that's generated by the device. Again, it's non-invasive. For somebody with chronic injury or chronic pain, it could reduce the likelihood of needing surgery, not that I was ever thinking in that route at all, but there's some people that maybe have, spine issues that there may be the concern that there may be a need for surgery at some point. Basically, just getting in there in the muscle, the tendons, the ligaments, helps to create new bone and blood vessels to support, to bring in nourishment into that area to heal it up. Increases cell energy for healing. So just very amazing. On his website, he talks about it. And it's FDA approved, okay, which is actually huge. It's an FDA approved, extensively researched, widely accepted, effective healing modality. Used for like foot pain, Achilles tendinopathy, chronic tight neck and shoulder pain, rotator cuff tendinopathy, tennis elbow, chronic knee pain, chronic low back pain, hip pain, shin splints, thumb arthritis, just goes on, right?
Thumb arthritis.
Thumb arthritis. Thumb arthritis. So I just think that these therapies, these services are like really awesome. I feel that they definitely are helping me, though I do need to stick to it for a few weeks.
So what do you feel after you've had one of these, one or the other?
So basically, and this is what happened, like the first time he did it and he did the shock wave, for like 2 days or so, I almost didn't feel any discomfort. I was like, oh my goodness, this is awesome. I'm not feeling any discomfort. And then slowly it started coming back. The second time I did it, I went for like 3 to 4 days without discomfort.
Okay. That was both with the PEMF or
and an adjustment.
Shockwave?
I just did on that one. On the second one, I just did, actually, I did do all 3 of them, 3 including the adjustment. Last week, I basically ran in there after one day I got out of work at a decent time, and I did just the shockwave therapy. I didn't do the adjustment. And this past week, I felt that I really didn't get a lot of relief. Now, whether it's because I didn't get the adjustment done, I'm not sure. But it definitely didn't last as long as it did the second time. The second time, I was shocked.
But that's when you had both.
That's when I had both. And I went for 3 to 4 days without any discomfort. Which for me, you know, I mean, I was like in heaven. So I'm actually going back again this afternoon, and I'll do the shockwave and an adjustment, because last week I skipped the adjustment, and you know, and it's really helped a lot. I think it's definitely, these services they all complement each other, right? They all act as adjunct to, you know, the adjustment itself, and, you know, they're meant to complement each other, you know, with time. The goal isn't that you have to continue doing this on a weekly basis, but that as you continue to have more and more longer periods of time where you're, you know, have less pain or you're pain-free, that then you just go, you know, for maintenance, like once a month. And that's kind of where I went, where I've not been the greatest as far as not being consistent with it.
Well, you start feeling good, and then you're like, oh, I don't need to go.
Exactly.
Right? The whole point of going is
but you're still living life and doing all the same stuff that's led to that.
Beating up on your body.
Yep.
Yeah, exactly.
Yeah, so anyways, I hope that, you know, hope you got something out of this, and definitely some really nice healing modalities, and something to keep in mind. All right?
Absolutely.
All right, so if you haven't connected with us and you'd like to connect with us, please check us out on our website, drlizcruz.com. There's a magenta colored button on the homepage. If you click that, you can schedule a free 30-minute wellness consult, and it's done on the phone, so you can do it from anywhere. Doesn't matter if you're across the world. All right, 30-minute free wellness consult for you. If you haven't subscribed to our podcast, please subscribe so that you never miss an episode. And lastly, if you haven't rated us, please give us a rating, and please give us a 5, because that will actually help other people just like you to find us. Thank you so much for joining us, and we will catch you on the next podcast.
Thank you for joining Dr. Liz Cruz and Tina Nunziato. To learn more about their revolutionary products and services, go online to www.drlizcruz.com.